right, Julianne. So we've heard you talk about what the heart is, what does it do, and how does it do it. So it's obviously it is the one of the most important organs in our body. Now, what happens though when things start to go wrong, and people start to develop heart disease? Now, I just want to quickly say that I've spoken to so many people doing this work with Core Magna, and many people often equate heart disease with just heart attacks. That's what we hear about most often. We read about it a lot in the news, and it's often communicated in a very dramatic way, given the nature of the situation. But I bet there's a lot more to it.
Yeah, there is. So heart attacks are one aspect of things that can go wrong with the heart. This is really related to the small blood vessels that actually supply the oxygen and blood to the heart muscle itself. So if they get diseased and they start narrowing off, you can get angina or chest pain. If you get a bigger version of that or a sudden blockage, then that's the heart attack that people speak of. But there are other things that go wrong with the heart. The heart valves can either age and start getting restricted, and remember I said they're like the gatekeepers, or they can break and let backflow of blood happen. So you're either getting problems with the forward flow or issues with too much backflow in the heart chambers,
Right.
and that can result in heart failure. There are other reasons you can get heart problems. The muscle itself can either thicken, stiffen, have things deposit in it that shouldn't be there,
Right.
or it can weaken. And if it weakens, you get a heart failure syndrome where people don't get enough efficient blood flow and oxygen to the rest of the body and the organs.
Right. So when you say it doesn't get enough efficient blood flow, we must be talking about some way to measure efficiency. Like how efficient is your heart, I suppose, is the question that I immediately had in mind when you talked about that.
Yeah, there are technical ways to measure that in a cath lab, but short of that, it's that you are functioning optimally, that your organs are functioning optimally, your brain gets enough oxygen, your kidneys can do their job, your liver can detox, etc.
Right. So sometimes people can develop diseases or heart failure where the heart is not functioning optimally, and it is quite literally failing, and it's not performing, it's doing its job in the best, not at 100%.
Correct. It's not that the heart just has stopped.
Right.
Heart failure doesn't mean that it's
that's
stopped.
really bad, isn't it?
Yes.
When your heart stops, that's a
death.
completely different problem.
Yes. But more that it isn't working at its optimal capacity.
Right. So I suppose it's kind of like if you had an engine in the car and it just didn't have all the parts working at 100%, but it's still going. You're still probably driving it, even though you probably need to get it checked.
Yes, absolutely. And, all you guys out there, take note. Go and get your regular car services. That's great. But when you do, remember that you should have yourself serviced. Go get a medical heart check.
That's so good.
And
so
make
when
sure
you bring
everything's
your car,
running all right.
That's a really good reminder. But every time when you're required to do the car service checks for your insurance, you should also get your heart checked.
Absolutely.
For your own health. Oh, I love that.
Who's going to drive the car if you can't?
That's right. I love that. Who's going to drive the car? Because you are in the driver's seat.
Yeah.
All right. I think this can go on forever, so let's get started. Now, what about this other thing?
Yes.
About you talked about the electrical side of the heart, and it sort of pumps at a certain electrical rhythm.
Cadence,
rhythm. Yeah. So sometimes that can go off as well.
Absolutely. So the heart has its own little electrical circuits, and it's usually very prompt and efficient and pretty regular. And it's that heart electricity that is stimulating the heart muscle to contract so it can pump, and that's its job. If something goes wrong with the electricity, then that leads to efficiency problems with the pump.
Again, right, yes.
So that can be that the electricity is too slow, it can be that it's too fast, or it could be erratic.
Right. So if people are feeling off in any of these ways, so too fast, I suppose, in the form of palpitations, they
Could
feel like
be.
their heart's racing,
Yeah.
or if they feel it's too slow, is that when people start to get a little dizzy, or
Yes.
right? Or if it's erratic, if it just comes and goes in bursts and spurts, and you don't really know what's going on, it would be good to get a heart check.
Yeah, definitely.
All right. Well, that's good to know. It might not be you're just suddenly quite excited or not. Actually, that might be a good question that people have. How do I tell if I'm just, particularly excited or anxious about something? And that can just be, something that comes and goes. It's a one-off event. Or if it's something that indicates it's probably something I should go and check.
Well, certainly if things are recurrent, then you should have that checked. If it's a one-off, getting some advice on that might be a good idea, even from the GP as a good start.
Right.
It might not require a cardiology visit, but certainly if something is a recurrent episode and it's impacting you. So if whatever you notice is having a flow-on effect that makes you feel lightheaded or chest discomfort, shortness of breath, anything like that, making you feel faint, those things need to be checked out.
For no particular, reason, no clear external
Yeah.
stimulant to this or precipitating factor. Well, that's really good to know, particularly because we do know that today heart disease is the biggest killer worldwide. I mean, the WHO has recently released some data on this, and we know that at least those who have reported it, there are 640 million people in the world who live with heart disease.
And as you said, still the number one killer. And it's the number one killer for men and for women. Breast cancer, for example, is not the number one killer for women.
That's a really good point, which in a way it's shocking and in a way it's not, because if it is the number one killer, then statistically chances are it is also the number one killer for women. But I was also listening to this podcast by a professor in the US, and I think he put a really stark number to it. Heart disease kills women 10 times more than breast cancer.
Yes.
That's really something for
Yeah.
us girls to think about.
Yeah, definitely. And look, with women too, we can present a bit later than men and we can present a little less typically than men do, which means that we don't necessarily have the same
Symptoms.
Yeah, angina or heart attack might not be chest pressure and chest tightness and things that people worry about. In fact, I had one lady whose heart attack was just wrist pain. So
Right.
it can be a little different for women, and I think that also speaks to why they present a bit later and then with a slightly worse disease.
And worse outcomes because you're not on top of it
Correct.
in time. Right, so there's a really important message here. So several things. There can be different types of heart disease, ranging from valvular, you've talked about that, the gateway. Then we need to make sure the rhythm's right, the electrical activity in the heart's right, and to make sure, the arteries and everything's clear, there are no blockages that might, that's what leads to the anginas and the heart attacks. And of course, any of these things can get worse and we can develop heart failure as a result when it's not working at 100%. It does not mean your heart has completely, stopped, but it's probably needing a bit of help and a bit of a boost from, medication, from good management plans. Also very important to know that heart disease presents differently for men and women. So for all the girls out there, please know that heart disease is still the biggest killer and that we should always get things checked out when we feel that things are not right. So listen to your heart and trust your gut.
Yeah, absolutely.
Thank you, Jodie Ann.
Thank you, Amber.